Welcome to our comprehensive guide on eyelid disorders. In this video, we'll explore a range of conditions affecting the eyelids, from inflammation and edema to chronic diseases like blepharitis and trachoma. Understanding these disorders is crucial, as they can impact both vision and overall eye health. We'll break down the causes, symptoms, and treatments for each condition, providing clear explanations and practical advice. Whether you're a student, healthcare professional, or simply interested in eye health, this video will give you valuable insights into the most common and significant eyelid disorders. Let's begin our journey by first understanding what inflammation is and why it matters. Inflammation is the body's natural response to injury or irritation. It acts as a defensive mechanism, aiming to protect and repair tissues. The causes of inflammation can be diverse, including chemical, bacterial, mechanical, or toxic irritants. When tissue is injured, the body initiates a series of changes to contain and eliminate the harmful agent. These changes are not just limited to the affected area, but can also involve nearby tissues. Recognizing inflammation is important because it often signals underlying issues that require attention. Next, we'll look at the specific pathological changes that occur during inflammation. During inflammation, several key pathological changes take place. First, blood vessels in the affected area dilate, increasing blood flow. This is followed by the exudation of fluid from blood vessels into surrounding tissues, leading to swelling. White blood cells, particularly leukocytes, migrate into the tissues to fight off infection or clear debris. Fibrinogen, a protein involved in clotting, accumulates in the spaces between cells. These changes reach their peak within 6 to 8 hours if the irritation persists. Understanding these steps helps us appreciate how the body responds to injury and why symptoms like redness, heat, and swelling occur. As the inflammatory process continues, the body works to resolve and repair the affected tissue. Vascular dilation gradually decreases, and the inflammation either subsides or progresses, depending on the ongoing presence of irritants. Damaged cells are replaced through proliferation or disintegration, and tissue fluids are reabsorbed, leading to a reduction in swelling. The cellular components of blood, such as monocytes, macrophages, and lymphocytes, play vital roles at different stages, acting as scavengers, destroying bacteria, and preventing the spread of irritants. This coordinated response ensures that healing can occur efficiently. Blood cells are crucial in the inflammatory response. Monocytes and macrophages act as scavengers, cleaning up debris and dead cells. Polymorphonuclear cells, or polymorphs, are responsible for autolysis and the destruction of bacteria. Lymphocytes help prevent the spread of irritants and assist in the formation of scar tissue. Each type of cell has a specific function, working together to contain the injury and promote healing. This teamwork among blood cells is essential for resolving inflammation and restoring normal tissue function. Oedema is a condition where body tissues contain an excessive amount of fluid. This can be localized to a specific area or generalized throughout the body. Oedema often results from increased permeability of capillary walls, higher capillary pressure due to venous or lymphatic obstruction, heart failure, kidney problems, or a reduction in plasma proteins. Inflammatory conditions and certain chemicals, such as bacterial toxins or venoms, can also cause edema. Recognizing the underlying cause is key to effective treatment. Oedema can be classified based on its cause. Inflammatory edema is linked to infections or irritants, while non-inflammatory edema includes angioneurotic or allergic edema, which often appears suddenly and may affect only one eyelid. Traumatic edema can result from insect bites or injuries, and systemic edema is associated with conditions like kidney or heart disease. Each type has distinct features and requires specific management strategies. Identifying the type of edema helps guide appropriate treatment. Angioneurotic edema, or allergic edema, typically has an abrupt onset and often affects one eyelid. The swelling, known as chemosis, usually subsides quickly but can recur. In some women, it may occur during menstruation, and emotional factors can also play a role. Although it is allergic in origin, the exact sensitizing factor is often hard to identify. Treatment usually involves systemic corticosteroids like cortisone or prednisolone to reduce inflammation and swelling. Blepharitis is a chronic inflammatory condition affecting the margins of the eyelids. It is commonly seen in children with poor hygiene, those exposed to smoke or dust, or individuals with refractive errors. Other causes include staphylococcal infections, parasitic infestations like crab, louse, or seborrhea of the lid and scalp. Blepharitis can be uncomfortable and persistent, often requiring ongoing management to control symptoms and prevent complications. There are two main types of blepharitis: squamous and ulcerative. Squamous blepharitis is often linked to abnormal metabolism, seborrhea, and dandruff of the scalp. Symptoms include itching, redness, swollen lid margins, and photophobia. Ulcerative blepharitis, on the other hand, is usually caused by infection and is characterized by yellowish, sticky scales, ulceration, bleeding, and sometimes permanent loss of eyelashes. Both types can cause significant discomfort and may lead to more serious eye problems if left untreated. Blepharitis presents with a range of symptoms, including itching, redness, swollen lid margins, and increased tearing or lacrimation. In squamous blepharitis, numerous whitish, dry scales are seen, while ulcerative blepharitis features yellowish, sticky scales, ulceration, and bleeding. Madarosis, or loss of eyelashes, can occur, and in severe cases, eyelashes may grow back, misdirected. Chronic cases can lead to complications like trichiasis, tylosis, ectropion, and persistent discomfort. Effective management of blepharitis involves both general and local treatments. Addressing underlying causes, such as staphylococcal infection, seborrhea, or refractive errors, is essential. Improving overall health and hygiene also plays a key role. Locally, scales and crusts are removed using a 3% sodium bicarbonate lotion, and antibiotics may be applied. Hydrocortisone eye ointment is often used on the lid margins several times a day for a few weeks. For parasitic infestations, specific ointments are required, and all affected areas should be treated simultaneously. Stye, also known as external hordeolum, is a suppurative inflammation of the gland of Zeiss and the eyelash follicle. It is common in young adults and often linked to staphylococcal infection or uncorrected refractive errors. Symptoms include acute pain, tenderness, and redness near the lid margin. Chalazion, on the other hand, is a tarsal or meibomian cyst resulting from chronic inflammation. It presents as a painless, hard swelling away from the lid margin. Both conditions require different management approaches. The initial treatment for a stye involves frequent hot compresses to promote drainage. If pus forms, evacuation may be necessary, either by epilation or a small incision. Systemic analgesics and anti-inflammatory medications can help relieve pain and swelling. Chalazion may require a vertical incision on the conjunctival side for pus evacuation. Both conditions benefit from local and systemic antibiotics, and in persistent cases, surgical intervention may be needed. Trachoma is a chronic, contagious disease affecting the conjunctiva and cornea. It is characterized by the formation of follicles and is caused by Chlamydia trachomatis, a member of the Bedsonia group of organisms. Trachoma is more common in children and women, especially in hot, dry climates and areas with poor hygiene. The disease spreads easily through contact with contaminated fingers, towels, or flies, making prevention and early treatment essential. Trachoma often presents with mild irritation, itching, foreign body sensation, tearing, and discharge. In early stages, there may be no symptoms in individuals with good hygiene and resistance. As the disease progresses, more severe symptoms and complications can develop, including photophobia and vision problems. Recognizing these early signs is important for timely diagnosis and management. Stage 1 of trachoma is marked by the appearance of numerous papillae on the thickened tarsal conjunctiva of the upper lid, giving it a red, velvety look. The eyelids may be slightly swollen, and a mucopurulent discharge is often present. At this stage, the cornea is not yet involved. This phase can last from 3 months to 3 years, depending on the individual's immune response and hygiene. Stage 2, also known as the follicular stage, is characterized by the presence of grayish, round, translucent follicles on the conjunctiva. These follicles are typically arranged in rows and are a hallmark of trachoma. Superficial keratitis and a lymphoid infiltration with vascularization, called trachomatous pannus, may also be seen in the upper cornea. This stage can last for 2 to 3 years and may progress or regress depending on treatment. Trachomatous pannus refers to the infiltration and vascularization seen in the upper cornea during trachoma. Progressive pannus occurs when the zone of infiltration and corneal haziness extends beyond the parallel superficial blood vessels. Regressive pannus, on the other hand, is when the infiltration and haziness recede, indicating effective therapy. Shallow corneal ulcers may develop at the edge of progressive pannus, but complete resolution is possible if Bowman's membrane remains intact. In stage 3, or the stage of cicatrization, the papillae and follicles disappear, leaving behind multiple irregular scars on the tarsal conjunctiva. Corneal opacities may also develop, leading to vision impairment. This stage can last for several years and marks the transition from active infection to chronic scarring. Early intervention can help prevent permanent damage. Stage 4 is the healed stage of trachoma, where scar tissue contracts and various complications may arise. These include corneal ulcers, trichiasis, misdirected eyelashes, entropion, inward turning of the eyelid, corneal opacity, xerosis, dryness, ptosis, drooping eyelid, symblepharon, adhesion, and even blindness. Managing these complications often requires surgical intervention and long-term care. Clinical diagnosis of trachoma requires the presence of at least 2 key signs: papillae or follicles, superficial epithelial keratitis, or trachomatous pannus. In early stages, diagnosis can be confirmed by identifying inclusion bodies in conjunctival scrapings. Accurate diagnosis is essential for starting effective treatment and preventing complications. The mainstay of medical treatment for trachoma includes tetracycline or erythromycin eye ointment applied at night for 2 months. Artificial teardrops are used if xerosis is present. Systemic antibiotics like sulfonamides, tetracycline, or erythromycin may also be prescribed. If the cornea is involved, 1% atropine eye drops or ointment can help relieve symptoms. Consistent and prolonged treatment is necessary to ensure complete resolution. Surgical intervention for trachoma is now less common due to effective antibiotics, but may be required for complications like entropion or severe scarring. Procedures include expression of follicles, excision of affected conjunctiva, tarsectomy, and keratoplasty. Prevention focuses on improving hygiene, avoiding overcrowding, and isolating new patients. These measures have greatly reduced the prevalence and severity of trachoma in many regions. Benorrhea refers to purulent conjunctivitis caused by gonococcal or Bedsonia group infections. Cupressin neonatorum is a type of purulent conjunctivitis seen in newborns, usually within the first 3 weeks of life. It is often bilateral and presents with swollen lids, congested conjunctiva, and a profuse discharge that becomes thick and purulent. Early diagnosis and treatment are crucial to prevent complications and protect the infant's vision. Cupressin neonatorum is most commonly caused by gonococcal infection, 27–30% of cases, staphylococcal infection, 35%, or viral infection. The infection is usually acquired during birth from the mother's genital tract or through contaminated towels and hands. Clinical features include bilateral swollen lids, congested conjunctiva, and a watery discharge that becomes purulent. The inflammation is intense, but usually subsides within a few weeks with proper treatment. Diagnosis of neonatal conjunctivitis is based on clinical findings. Prophylactic measures include careful antenatal care, aseptic delivery practices, and immediate postnatal eye care with saline washes and antibiotic drops. Curative treatment involves hot fomentation, frequent irrigation, antibiotic eye drops or ointment, and atropine if the cornea is involved. Systemic penicillin remains the drug of choice, with alternatives for sensitive cases. Treatment should continue for several weeks to ensure complete resolution. A black eye, or hematoma of the eyelids, occurs when trauma causes blood to collect in the loose connective tissue of the eyelids. Even minor injuries can lead to significant swelling and discoloration. The swelling may make it difficult to open the eye and can last for 1 to 2 weeks. Treatment involves cold compresses in the early stage to reduce bleeding, followed by hot compresses and gentle massage to promote absorption of the blood. Trichiasis is a condition where eyelashes grow in the wrong direction, rubbing against the cornea and causing irritation. The lid margin remains in its normal position. In some cases, an extra row of lashes, known as distichiasis, may be present. Common causes include scarring from trachoma or burns, blepharitis, injuries, or eyelid surgeries. Symptoms include foreign body sensation, watering, photophobia, pain, and sometimes corneal ulceration. Treatment for trichiasis depends on the number of misdirected lashes. If only a few are involved, epilation or electrolysis can be performed, but the procedure may need to be repeated. For extensive involvement, plastic surgery may be necessary, similar to procedures used for entropion. The goal is to prevent further irritation and protect the cornea from damage. Entropion is a condition where the eyelid margin turns inward, causing the eyelashes to rub against the eye. There are 2 main types: cicatricial entropion, caused by scarring from trachoma, burns, or conjunctivitis, and spastic entropion, often seen in older adults due to muscle spasm or lack of support. Symptoms are similar to trichiasis, including irritation, watering, and pain. Treatment for cicatricial entropion includes resection of skin and muscle or mucus graft operations to push the eyelashes outward. For spastic entropion, addressing the underlying cause of muscle spasm is key. Temporary relief can be achieved by pulling the lid downward with adhesive plaster. In severe cases, surgical correction is necessary to restore normal eyelid position and prevent corneal damage. Ectropion is the outward rotation of the eyelid margin, exposing the inner conjunctiva. It can result from scarring, cicatricial, muscle spasm, spastic, nerve paralysis, paralytic, or age-related changes, senile. Symptoms include constant tearing, epiphora, redness, dryness, and, in severe cases, exposure keratitis. The exposed conjunctiva may become red, dry, and thickened, and the lower lid can develop dermatitis from constant moisture. Treatment of ectropion depends on the underlying cause. For cicatricial ectropion, a VY skin excision and Y-shaped suturing are performed to relieve the pull of scar tissue. In extensive cases, a skin graft may be needed. Spastic ectropion is managed by treating the cause of blepharospasm. Senile ectropion may require full-thickness shortening of the lid, while paralytic ectropion is treated with lateral tarsorrhaphy to reduce the palpebral aperture. Symbolpharon is a condition where there is adhesion between the palpebral lid and bulbar eyeball conjunctiva, most often in the lower lid. Causes include burns, chemical injuries, or ulcerations that create raw surfaces. There are 3 types: anterior, at the lid margin, posterior, in the fornix, and total, complete adhesion. Symptoms include double vision, cosmetic disfigurement, and exposure keratitis due to restricted eye movement. Prevention of symblepharon involves applying eye ointment and moving a glass rod in the fornices several times a day, or using a therapeutic contact lens. If adhesions develop, surgery with mucous membrane grafts or plastic surgery may be required to restore normal eye movement and appearance. Early intervention is key to preventing permanent adhesions and complications. Lagophthalmos is the inability to fully close the eyelids, either due to congenital or acquired shortening, facial paralysis, ectropion, or proptosis. The main complication is exposure keratitis, especially in the lower part of the cornea. Treatment focuses on addressing the underlying cause, using antibiotic ointment and bandages to protect the eye during sleep, and performing lateral tarsorrhaphy in cases of paralysis. Blepharospasm is a spasm of the orbicularis oculi muscle, causing the patient to tightly close their eyelids. It can be triggered by corneal irritation, foreign bodies, or inflammation, and may also occur in hysteria or general fatigue. There are tonic and clonic forms, with the latter involving twitching. Treatment involves identifying and addressing the underlying cause of irritation. Ptosis is the drooping of the upper eyelid, which can be congenital or acquired. Congenital ptosis is usually bilateral and due to underdevelopment of the levator muscle. Acquired ptosis is often unilateral, resulting from muscle weakness, nerve palsy, tumors, trachoma, oedema, or hypertrophy. Ptosis can cause visual disturbances and cosmetic concerns, prompting patients to compensate by tilting their back or raising their eyebrows. Treatment of ptosis involves searching for and addressing the underlying cause. Various surgical techniques are available, and the choice depends on the type and severity of ptosis. The goal is to restore normal eyelid position, improve vision, and achieve the best cosmetic outcome. Early intervention can prevent long-term visual impairment, especially in children. Tarsorrhaphy is a surgical procedure where the eyelids are partially sewn together to protect the cornea. It is used in cases of paralytic ectropion, facial paralysis, exposure keratitis, exophthalmos, and non-healing corneal ulcers. The procedure can be temporary or permanent, and the sutures are usually removed after about a week. Tarsorrhaphy helps narrow the palpebral aperture, reducing corneal exposure and promoting healing. The equation $x, 2 plus y, 2 equals z. $2 represents a Pythagorean triple and is fundamental in understanding right-angled triangles. In eye anatomy, this concept helps in calculating distances and angles within the orbital structure, which can be important in surgical planning and diagnosis. Understanding geometric relationships in the eye region aids in achieving precise outcomes in reconstructive procedures. Eyelid tumors can be benign or malignant. Common benign tumors include warts, naivy, moles, and papillomas. Warts and naivy are usually pigmented and may involve both the skin and conjunctiva. They often grow during puberty and rarely become malignant. Papillomas are the most common eyelid tumors, appearing as sessile or pedunculated growths with a keratinized surface. While most are harmless, some may undergo malignant transformation and require removal. Papilloma is the most frequently encountered eyelid tumor. It may be sessile or pedunculated, with papillae on the surface containing keratin. Each papilla has a fibrous core with blood vessels, covered by proliferated epithelium. Although usually benign, papillomas can rarely become malignant. Complete and extensive excision is recommended to prevent recurrence and ensure safety. In this video, we've covered a wide range of eyelid disorders, from inflammation and oedema to chronic conditions like blepharitis and trachoma, as well as tumors and structural abnormalities. Understanding the causes, symptoms, and treatments of these conditions is essential for maintaining eye health and preventing complications. Early diagnosis and appropriate management can make a significant difference in outcomes. Stay informed, practice good hygiene, and seek medical advice if you notice any persistent changes in your eyelids or vision.